Hi, good day to you. This is Dr. Amihan, your humble servant in health in the northern part of Antique. Hi, how are you? I hope that you are all okay at the comfort of your home. So once again, our topic for today is about the effectiveness of betadine, or is betadine effective against COVID? Can it prevent contracting COVID? So watch this. As you all know, betadine is used as gargle. It is also used as an oral spray, an intranasal spray, the one that is available in the market today. And there are also betadine that is used in cleaning the wounds or cleaning your cut or any scrapes in your skin. It is also used in cleaning the skin before surgical procedures or before any operations. Okay, so we have to talk on this betadine that is used in cleaning the wounds and in the cuts or any scratches in your skin, or cleaning skin surfaces before the operation. Because this type of betadine during the pandemic, in some other countries, people in the absence or without the advice of the doctor, they use a portion of it and then mix it with in water or any solution, and then spray it in their nose, in the oral area, and use it as gargle. The betadine that we use during surgeries and cleaning the skin and cleaning the wounds. So they use it. So you're laughing there, but it is true. It is very dangerous because it can cause irritation in the nose, irritation in your mouth, and irritation in your airway and in your digestive tract, because the concentration is high and it is very irritating. But the betadine that you buy in the market had a low concentration and it has less side effect. Okay, so that is the difference. And the betadine that is available in the market, sold in the market for intranasal spray and oral spray and for gargle, is just for the treatment of sore throat. It is not actually used for COVID. There is no indication because there is no study that it is used for COVID and it is effective in treating COVID. Okay, there is no study with that. Actually, some scientists said that the use of betadine spray, oral spray, and gargle that is available in the market does not have an impact on the treatment of COVID. Okay, and it is even dangerous because some of those persons who use the betadine preparation, they think that they cannot contract COVID if they use it, so they don't vaccinate themselves, so they become the victim of the virus and they got sick and got severe disease. Okay, as what I've said, the oral spray, the intranasal spray, the gargle form of betadine in the market is used for sore throat alone. Even the company tells us that it is for sore throat, not for the treatment of COVID. Okay, but there are studies with the use of betadine spray, oral spray, and gargle published in the Journal of American Medical Association in the US. It is effective in decreasing the virus in the nose and in the mouth if you already had COVID, if you already had a disease, it will decrease the SARS-CoV-2, the number of SARS-CoV-2 or the volume of viral or the load of the virus in your oral cavity, in your intranasal cavity. If you use the intranasal, the oropharyngeal, and the gargle form of betadine that is available in the market today. But it cannot prevent COVID. You should always remember that. The best way to prevent COVID nowadays is to have your vaccine. Get an mRNA COVID-19 vaccine, and after that, if you have been vaccinated 3 to 6 months ago, you can have a booster now. That is the best way to prevent COVID. Plus, the application of your non-pharmacological, non-pharmaceutical layered approach, such as your wearing of mask, face shield, social distancing, avoidance of going to super spreader events, and going to a closed room, poorly ventilated room, packed or crowded with people. That is one the best way. And personal hygiene. So you should always remember that. Apply those non-pharmacological and non-pharmaceutical approach together with your boosters and your vaccinations. That is the best way to prevent COVID against disease severity, hospitalization, and death as of the present time. So this is Dr. Amihan, your humble servant in health, wishing you the best of everything. Good day. Bye. See you soon.